Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the follicular cysts of ovary. Ovaries are two in number oval organs approximately 3 centimeters long, 2 centimeters wide, 1 centimeter thick, lying on either side of the uterus. They lie near the lateral wall adjacent to the anterior superior iliac spine. The functions are ovulation and production of hormones, mainly estrogen and progesterone. They influence the woman's feminine physical characteristics and affect the process of reproduction. The pathology of the ovaries are described as the cysts and are of three types. Retention cyst. It is the retention cyst of the Graffier follicle and may form as a follicular cyst or corpus luteum cyst. The second type is the cyst in a neoplasm. The third type is a cyst filled with altered blood due to ovarian endometriosis or hemorrhage into corpus luteum. Cysts of follicular system. Ripening and atresia of follicles or proliferation and regression of the corpus luteum are normal and physiological process. A Graffian follicle or the corpus luteum may become cystic by overactivity. It is difficult to decide whether it is physiological or pathological. The rigidity, the right ovary being accessible through the muscle splitting incision of McBurney's has been the more frequent victim of misguided surgical enthusiasm. The distension or retention cyst of the follicular system can be classified as a follicular cyst, corpus luteum cyst, or menstruation, pregnancy, persistent corpus luteum, and hematoma. Third, granulosa lutein cyst and theca lutein cyst. The etiology is obscure, but facts accepted are excess chronic gonadotrophin, pituitary gonadotropin, or therapeutically administered gonadotropin, human pituitary gonadotropin HPG, human menopausal gonadotropin HMG, and human chorionic gonadotropin are all associated with cyst formation in the ovary. Sometimes clomiphene is also associated with cyst formation in the ovary. The example of this is the compound granulosa lutein cyst found in the ovary in hydatidiform mole where the HCG reaches a very high level. Hyperemic cyst of the ovary with congestion is an undoubted cause of retention cyst. Retroversion, pelvic congestion due to inflammation, increased blood supply due to presence of myomata are all examples of ovarian congestion in which a cystic state of the ovary is found. Follicular cyst. Follicular cysts are either from the ripening of the arteric follicles. They are regarded as pathological if they are more than 1 inch in diameter, or in the ovary is studded with a series of small cysts of this kind. The ovum degenerates and disappears early, but the granulosa cells and theca cells may persist in functionally active state for some time. In case of estrogenic follicular cyst of metropathia hemorrhagica, this activity may last for many months. However, the Mounting intracystic pressure causes the atrophy of the lining cells with the loss of function. That is why the lifespan of the follicular cyst is self-limited and surgical interference is seldom indicated. These are thin-walled and contain translucent colorless fluid. Hydrops folliculi. Different forms of follicular cysts are recognized. They are hydrops folliculi. A single large follicular cyst is present in the ovary. This condition is very common and must be distinguished from a cystoma simplex, which has some appearance and is a new growth. Distinction may not be possible even by histological examination. If the ovary and the tube are mated together by adhesions as a result of previous inflammation of the appendages, the ovary frequently contains several medium-sized cysts up to 2 inches in diameter. Follicular cysts are not uncommon. In the large hyperplastic ovaries of patients with myomata, metropathia hemorrhagica, cyst may be present in the metropathia hemorrhagica. The cyst associated with metropathia retains its granulosa cells in a state of activity and which may show some degree of luteinization. Sclerocystic disease. Sometimes, as in polycystic ovary, the ovary is symmetrically enlarged with a thickened white tunica albuginea and its cortex is radialed with small follicular cysts of about 0.25 to 0.5 inches in diameter. Hyperplasia is also associated in the theca cells of the stroma, hence called hyperthecosis ovariae. About 30 small follicular cysts may be found in the same ovary. The peritoneal surface of the ovary is free from adhesions. Normal corpora lutea are formed but may be hyperplastic. The disease usually arises in young women and the appearance are similar to that seen in Stein-Leventhal ovary associated with virilizing syndrome. Stein-Leventhal syndrome. It is a virilizing syndrome seen in young women with develops secondary amenorrhea, obesity, hirsutism, subnormal breast development and acne. There is a bilateral enlargement of about 3 times the normal size of the ovaries. The ovaries contain many cysts in the lining of which theca cells may be identified. The theca cells are thought to be the source of androgen. Treatment. The condition is often amenable to surgical correction by bilateral edge resection, a form of partial oophorectomy. Follicular hematoma. The follicular hematoma are usually small, particularly in case of uterine myomata. The ovary contains hemorrhagic cysts and occasionally may burst into peritoneal cavity and cause intraperitoneal bleeding of the severity equal to that of rupture of ectopic gestation. The hematoma is usually small and is restricted to the wall of the follicle as granulosa cells layer is non-vascular and the membrane limited externa separates the vascular theca interna from the cavity of the follicle. The old altered blood contents of a retention cyst into which a hemorrhage has occurred become tarry and gives rise to one variety of chocolate cyst. It is to be differentiated from rare endometriosis. That is all about the follicular cyst of ovary, and in the next video I will discuss about some other disease. Thank you.